Good afternoon. You're watching EMTV's COVID-19 awareness program. The question of getting information from credible sources on COVID-19 is still a major concern throughout the world. The World Health Organization is addressing this infodemic surrounding COVID-19.
We've been working with a large number of platforms and Google and Facebook, and I'm gonna list them, but I'm gonna forget to name them all, with Viber and WhatsApp, to make sure that information that is put out is accurate information. We have been fighting this infodemic since the beginning. There's a lot of information that is out there that is inaccurate, and we're working very hard to ensure that when someone searches for COVID-19, that the first thing that comes up is a reliable source. And that would either be a WHO website or national websites, and so that you can find accurate information. And so when you search, you find the latest accurate information, because this is an evolving field. It is confusing out there because unfortunately sometimes the misinformation gets circulated more. So each of us has a responsibility that when we see something and we see something that is false, or we think something is false, we don't pass that on. That's our responsibility as well. But we're trying to ensure that we address the myths, we address the inaccuracies. We have something up called Mythbusters, where we hear about rumors, potentially rumors that could be damaging and harmful to health. We address those head on to make corrections.
Words from WHO's Dr. Mario Van Kirk Oh. Now, Bradley, important threat or some you must give some information, anything you may like survey long COVID-19 must come law all credible sources where you may be repeating plenty time penis display program and all sources blogger one plan WHO now nara plateau.
Yep, I'm true. Now, didn't look him plenty time straight long display program you may use him display same talk na ating all man too and all tired penis long harem display talk tasol. Important long you may all get a long country too long. Behind him all display all credible sources me platok long him all hapo you can go long him long kiss him all story and all information na halivim him long side long COVID-19. Now sample long all display all credible sources or all websites na all pages lo social media or me platok long him you can go long him official government website that's covid19.info.gov.pg. You go along display website number karami go straight long all latest releases na all talk with government igad long em you can find him all along display hub display 2 you can find him all talk with controller I walk him mogata all stop long hapo you can find him too narapla hapo you can go na kisi more credible information long website long me play at EMTV online na two Facebook pages long mipla where you can find him all information where you need him long him na narpla website two na social media page where I think a more credible straight long all viewers long go long him WHO website Papua New Guinea WHO PNG Facebook page, that is www.facebook.com/WHO Papua New Guinea. And that's where you can get some of the information, relevant information and factual information you need with regards to COVID-19 and what the authorities are doing in Papua New Guinea.
Narapla something to lo tokila lo all man meri time all stop online na information all share him long. This is all websites me plug in pinisa no blue lo redeem ta sol na lusim blue lo make him work lo help him government or health workman meri lo share him information too, and when you're sharing information you share him lo display website no can share him nothing just any information, anything to everything you come across on Facebook. Most of them most times are not correct damaging information and they're damaging.
Of course, so look, plenty time you may talk pinis long all right information or credible information din you walk long go out na by you find mo some all misinformation or talk where all man just give him opinion long all tasol or you ba looking mo some plenty more man I behind him display talk because you know true or some platok pinis all authorities or some controller prime minister and all minister you work one time all authorities blung me got long health na WHO and all partners blung all work boom one time you can go long kisim all get the information you need him na long painim dislam ba you go long display credible sources long kisim display.
I think some blow control measures too blow now currently in place for us Papua New Guineans going through this SOE is also on some of the PNG credible sites as well.
Of course, Dini. Now look, plenty old man ko ask him display, ask him last week time commissioner SOE controller David Manning he make him talk clear also if I got sample more also all something belong behind him also me put him go also curfew long 8 p.m. going up 6 a.m. long morning long narapla day display something all still out PMV non apron all kind of something also you can still find him long display website 19 plenty old man walk long look him display website 9 o'clock share him so plenty old man Mary sawe good yet long also display all measures where government he put him in place he come into effect na by end lo one time and you can find him long up.
I think for the educated population you have when you have access to this information online do your bit to educate the next 3 or 4 people. Time you go online, you look and display information, don't just read it and leave it be. Make sure you share him on your social media platforms or you story one time online or house line blue. At least you story lo narapla tripla fopla man lo information you come across them. That's how you spread information faster by doing that.
And we spoke Dini about this I think briefly last week about a healthy relationship with the internet and that's one of them. If you cannot if you are bombarded with the information already at hand you feel most mind blown you pull up in this one time information on COVID-19 you got on other areas too related long COVID-19 where I think you can read or saw long ema or something or something long walk him long display time long this last state of emergency or time you stop on house or legal or something you can walk him one time family or exercise. I think I'm different legally long online long place where only got freedom long or some stop long boost na get connected with nature of course at this time long online long solwara all can go pull in peace of course but not in big groups like we said. Social distancing, we're advocating for that as well. Now line long antap long bus long highlands too. Osem long opainim all kai long bus or sit down go long garden. I think all walk long still. Walking body long yumi active na stop fit long display time.
Na narapla something to lo mention him all. For us, the ones living in town, we have access to information. All family blaming, all mana merry long place. If you have access to, you're always in contact with them, make it your business to educate a family member back home, and they in turn can educate others in the community or in the village back home, because even though the government is doing its bit to, share information, spread out information, using all the mediums, radio, internet, television, newspapers, plenty blow because of our geographical settings, and it's very challenging to get information out there. Some people don't have good radio signals. Most people don't watch TV. Getting newspapers every day is quite challenging, and definitely internet access to internet is a challenge out in the rural settings as well. So if you do a phone call, if you do a phone call back home, make it your business to educate a family member back home, and they in turn, like I said, can educate the next 4, and the next 4 can educate the next 8 to 16.
Yeah, well, Dini, that's very interesting because I got a call last week from one of my relatives back home who called after watching several of our shows, and he was telling me, look, son, you have to take care of yourself during this time. From the information that we're giving to the people in the rural areas, and for them to call back and give this sort of feedback was pleasing, and they at the village level saw the seriousness of this pandemic and what it can do to humanity, and especially the population in the towns and cities as well. So it was quite a good connection there, looking at the information that we are giving out, and for people in the rural areas to respond that way was a positive sign. And I think taking heed of the information out there, there are people there in the communities, in our towns and also in our villages, who are taking heed of these, precautionary measures by government. Yes. and are following on the credible sources, like we said, and using the traditional mediums as well to monitor stories and also awareness messages that's out there.
Yeah, look. And I believe there's another update as well from Dr. Mario Bradley.
Yes. Okay, so emphasizing COVID-19 cannot be contained. She made this emphasis when responding to question relating to African people being resilient.
Containment is possible. Containment is possible of this COVID-19 virus. We have seen in a number of countries now, not just in Asia, in a number of countries across Europe, that we're facing this horrible outbreak where they brought it under control. And Africa has an incredible resilience that Mike has outlined in terms of its ability to fight infectious diseases and to mount a response, to find cases, to care for cases, to engage communities and build up communities and empower communities to be able to fight this. And so I was a little worried in what you said. I don't want you to lose hope. Containment is possible. It's going to be a hard fight. But we are here, and our African regional office is there, and our country offices are there, and the whole world wants to help. We need to do more. We need to empower everyone with the ability to test and to find cases, to have treatment centers available so that people can be cared for appropriately, to make sure that we practice physical distancing, to be able to have hand washing stations where we don't have running water. There's a lot that we can do, and I just wanted to highlight that containment is possible. This virus is containable.
Yeah, look, Dr. Mario Van Kirk Oh from WHO clearly outlined COVID-19 can be contained, and we need to listen to preventative measures that are put in place to minimize the spread of this virus. Stay tuned for more on COVID-19 when we return after these short messages. Welcome back. There is a question being asked if COVID-19 can be spread through coins and banknotes. There is currently no evidence to confirm or disprove that COVID-19 virus can be transmitted through coins or banknotes. However, respiratory droplets expelled from an infected person can contaminate and persist on surfaces. Now, wash your hands regularly and thoroughly after touching any frequently touched surface or object, including coins or banknotes. Now, avoid touching your eyes, mouth, and nose if your hands are not clean. Now, another point is on stigma and discrimination, which we would like to stress on. People must not be stigmatizing persons of interest or anyone for that matter when it comes to COVID-19. Stigma can cause stress and anxiety and can be harmful to a person, including their families. Now, Bradley, we've been stressing on this over and over again. Dysplastic, line all no ask him looks in dysplastic, so you may not can put him. We can't do the blame game right now on persons of interest or even the positive cases.
Of course, Dini, now that the cases have increased in Papua New Guinea, yes, in light of the additional 5 detections in Port Moresby as of late last week, there have been many connotations or labeling, yes, should I say, of provinces that have this virus or disease, COVID-19. Now, look, it's not. We cannot blame any particular person or ethnic group for that matter. Like we said, it could be your sister, it could be your mother, it could be your brother, it could be your father or your closest relative or loved one. So in this case, let's all work together is the message that we've been always advocating. So too the government and its partners at their level, and I think that's the message that we all should adhere to and work together as a team to solve this. Now you mean put him hand blame na to okay, you started this, you started you got sick, got sick, no got. Let's treat it like any sickness, not ordinarily, but with some level of care and caution when we're addressing this issue.
Now we're still in the SOE period. If you can just recap on the SOE orders for our viewers.
All right. So still in effect, the SOE orders implemented or which came into effect last week after the SOE control announced it late last week. These are specifically for provinces NCD, Central and Western Province, of course, and if you don't mind, I will just go through them again for the sake of the public. So all man meri suppose long stop araside long house long all or banis long all long 8 p.m. going up long 6 a.m. long morning so number one. Number two all get all big kibung where you long come up long public government itambuim long display time because you miss our COVID-19 or sick coronavirus all man is our pasima. So this like kind of big plabung place where potentially this plasiki can kalapigo long nar plaman time one play kus or infect him all surfaces will nar to touch him. So restaurants all house kai inap long op long display time tasol all must save him take away tasol display measure where government put him in place long display time. Two all customary boom or where isa come up long government itok tambu long tasol inap long ananit long o sem 4 plamanta so you can go come up long display kibung gaman itambo him to all public transport inside long city so display limit tok long PMB bus na all taxi to long display time until government apim display display wanema measure na only walk him long so publics when sale na purchase belong all get all alcohol products government itambo long display time two all flights inside long Papua New Guinea two government itambo long display time all flights where government give toko right as all through long controller all can go around inside the country. I think carrying more important something you miss have a penis long walk long display fight against him COVID-19. Now, gaman itambo him to all big plakibung na osem all cash place belong drink beer all sporting venues too na all house lot to all man by bung long big plan numbers government itok nogad long display time so me plan understanding mosem long April 30th display order by expire na I think government that come out clear na make him all talk long suppose by me behind him display yet or all new orders by come out.
All right, so apart from that, keep practicing your hand hygiene by washing your hands with soap and water for at least 20 seconds. Remember, wasiman good all the time, one time soap na water for at least 20 seconds. Kai good, eat healthy, make sure it's a balanced meal, maintain physical distancing, and cough. When you cough or sneeze, do so into a bended elbow or a tissue and dispose of the used tissue properly in an enclosed bin. Now avoid at all costs, avoid touching your eyes, mouth and nose if your hands are not clean. Get updates from COVID-19 from credible sources to avoid misinformation which may lead to fear and panic. Now for more information on COVID-19 update in the country and what the authorities are doing, visit EMTV online website and Facebook page for regular daily updates and also join our news team for stories as they happen. Before we go, EMTV would like to thank the following partners: Protex and Telecom, whose support has made this program possible to inform, educate, make aware, prepare and update Papua New Guineans nationwide on COVID-19. Living now with Reverend Pastor Joseph Otis.
Good afternoon. Another story of boats And this time, another well-known story in Luke chapter 5 is the story of an experienced fisherman who all his life from his childhood days knew how to catch fish. He knew the tactic and the techniques involved in catching fish, but that day and that night he hooked all night and caught nothing. I'm sure he must have been one angry and hungry and sad and miserable person that morning. His name was Peter. But Jesus all along has been watching and observing this fisherman, and Jesus needing a platform or a stage that he could use to project his voice to preach to the bigger crowd that was building near the shores of Galilee, asked to use Peter's boat. And Peter surrendered his boat, which is a picture of his life, and Jesus entered his boat. Let me encourage you to surrender your life, your home, and your family to Jesus, and let him come into your home and life or your boat just like Peter did. And when Jesus came into Peter's boat, the whole world for Peter changed. He went from zero to hero and nothing to everything. Not only that, he identified with his call and his destiny when he realized that this person who never catch a fish or who never caught a fish or never went fishing must have been a master fisherman, because at his call and presence in his boat, Peter's boat was filled, the net was breaking, his partners came to help, and their boat was sinking. Jesus is on a rescue mission, and he can rescue you from your situation today if you allow him into your boat, your life. God bless you.